Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm speaking with Acacia Parks, the Chief Science Officer at Happify Health. How are you today?
I'm great. Thanks for having me.
I was going to say Happify, and then I remembered I have to say the health, so we threw that in there. I'm excited to have you on the podcast today. I'd love if you kick things off by telling the audience a little bit about your background, and then we'll talk more about Happify Health's mission and really what you're building.
Sure. So I'm a research psychologist by training. I started off in, as an undergraduate psychology major, sort of really stunned to learn about these sort of statistics back at that time. This is 15, 20 years ago, that there was this gap where people needed treatment for mental health conditions like depression and anxiety and couldn't get it. And this was something that kind of galvanized me through to get my PhD in psychology. I worked with Marty Seligman at the University of Pennsylvania, where we really kind of pioneered this idea of combining different approaches. So kind of looking at everything that works, that is published, that people know if you do it in the lab, if you do it in a research study, it helps people get better and actually get that to people out in the real world. And so that's kind of been my single-minded focus. And so when I had the opportunity to work with Ofer Leidner and Tomer Ben-Kiki, who are the co-founders of Happify, to create this company, which we did together. The goal really was to kind of take what we know works and get it to people. And so my passion has been that from the lens of psychology research. And so my role at Happify Health is to lead our research program and our research strategy that helps validate the things that we create and get the data we need to see how we're impacting the people that use our products.
Thank you for sharing. And I'd quickly like to play off of your background. Can you dive a little bit more into, you can combine it any way that you want to. You can state it as, the mission, vision, and how you're differentiating from your competition. Or you can even go as far as saying the why, how, what, which I usually end up focusing on in the podcast. I'll leave it up to you. But if we could learn a little bit more about that, we can kind of transition into some of the other key topics you and I wanted to cover here today.
Yeah, and I think I sort of level set at the beginning, right, that this is so much about translating what the research knows works and getting it out to the general public. And so we've been developing digital therapeutics to address, manage, and treat psychiatric disorders, and to improve the health status of people in experiencing health conditions where their mental health interacts, right? So we know that the mind and body are connected, and that when people have high levels of stress, depression, anxiety, these things make their physical health worse as well. So really broad approach trying to address those things. So we've been doing that for years now. Using self-guided digital health platforms. So we have a single platform that kind of combines a patented AI that we've created with these clinically validated digital therapeutics that we've pulled from the literature that are effective, based on decades of research from many different research labs. We're using those things in this sort of digital format integrated with AI. And we do that with a couple of different approaches. So if you look at how traditionally both researchers and in industry people do this, they're like, cognitive behavioral therapy, here you go. They're like, have some mindfulness, right? It's like we have this one approach and we're going to deliver it to you. And for us, it's all about kind of taking everything that works and putting it together in this sort of versatile platform that we can use to serve people in a much more wellness capacity. We can modify to make it more about managing symptoms of depression and anxiety. We can turn it into a prescription treatment. It's kind of the same foundation in terms of what we're trying to do, but we can tweak it. We can beef it up or make it lighter depending on who we're trying to help, with the ultimate goal of impacting the entire spectrum of anybody that could benefit from a mental health intervention.
At what point in your career did you know you wanted to be a part of a team like Happify? This wasn't one of the things. I want to bring it up because I can tell how passionate you are, and
yeah, it's a great question. I know the answer, right?
Okay.
So I know the exact moment, right? So I was still a college professor. I was about to get tenure or had already gotten tenure, and I was presenting at South by Southwest with Ofer, president of Happify. And first of all, I'm like, whoa, here I am going to South by Southwest. So like that was a bit of a, a moment when I started to think about the impact that we could potentially have. But at that time, that I was with Ofer when he learned that we had reached 1 million users on our consumer platform. And like now it's over 5 million. And like it's gotten so much grander than that. But it was that inflection point for me where I thought, wow, we're actually doing this. I need to stop doing everything else and only do this. So I think that was in 2015 where I just like fully committed to what we were doing, having seen that that goal of having a broad scale impact was something we were really doing.
And everyone needs to watch this video to see how excited you just got talking about why you joined the team, because you are beaming, and I love that. And it's awesome when, one of my favorite quotes is, I forget who says it, so I'm probably not doing it justice to whoever originally said it, but in order to do great work, right, you have to love what you do. And that's super clear with you. South by Southwest, I haven't heard that. That because of COVID and everything that happened.
It was, back in 2015. Yeah. It was a different time.
That was always, though, like one of the, I never had the opportunity to go, but huge conference where so much
overwhelming scale. Yeah.
Yeah. So much innovation though was discussed there. And it's similar to like, there were so many, right? There was like CES in like Las Vegas and obviously in the healthcare community, HIMSS, and now the health conference coming up in Boston. It'll be interesting that when those conferences start coming back more in full-fledged and we're able to have in-person networking. But I want to quickly shift our focus, Acacia, to your newest basically offering that you recently launched, right? I think it was in the last couple of weeks you launched this. And if I'm putting an accent on this, just please correct me, but like Ensemble, or is it Assemble?
No, you got it.
Ensemble, right? Okay, perfect.
Yeah. Like a bunch of instruments playing together in harmony.
I love it. I always, I say things the way I think I say them, but everyone has their own way of saying certain words now. So I just want to be sure. But
yeah, you cannot imagine how many ways I've heard my name pronounced that are not correct. So I understand.
By the way, everyone who's listening, 3 of which I might have said before we started this. So it's good that I finally landed on it. But
you got there in the end. That's the important part.
That's all that matters. I'd like to dive in a little bit about that latest launch. And so if you can give us like the significance of it and an overview, would be much appreciated.
Yeah, so Ensemble is a convergence of a number of things. Some of the things I've already articulated, right? We have, over 8 years of experience preparing a versatile platform that is ready to do something like treat depression and anxiety. We hadn't done it yet. We knew it was on our roadmap. And then the FDA issued an emergency authorization related to COVID that essentially enabled digital therapeutics companies to release products to help the exploding number of patients who are suffering from significant mental health disorders during the pandemic. And so there was this unique opportunity to release a product that it might have been years until it was released if it went through traditional channels, but the need was recognized by the agency, and we rose to that need. So we had, kind of lots of data already about different use cases of our platform in more or less severely depressed or anxious users. We published an RCT a few years ago with over 1,000 patients where we were looking at the efficacy of our programs, focusing on people who had more severe symptoms. So it wasn't a treatment, at that time, but we were able to kind of look at it in that use case. So we had this sort of like existing data that suggested we had something that could work in this population. And so we started to internally build that up and validate it into a prescription digital therapeutic, which is Ensemble. And so it was kind of in response to that urgent need for kind of broad-based, right, mental health treatments, not just, here's just for MDD, major depressive disorder, here's just for generalized anxiety disorder, but these are the things that people are experiencing the most in COVID. I had a 6-month bout of general anxiety disorder myself during the pandemic. So this is very personal to me and very real. This, I had no history of anxiety whatsoever, but the pandemic is bringing things out in people. So, we were able to sort of leverage our existing products and the kind of 5 million users worth of data and all the different use cases and the published research that we had so far to manufacture a prescription digital therapeutic. And nobody has created something that's what we call transdiagnostic, right? It's both generalized anxiety and major depressive disorder in one digital therapeutic product. It's the first ever of its kind. It's also kind of keeping in spirit with all of our general philosophy about, like, I'm not just going to bring you this one approach. I'm going to bring you the various approaches that work for these disorders, because we want everybody to find something that's going to work for them. So this is something that we felt like we were poised to do rapidly because of everything that we had going in and the opportunity of the FDA having a call for these types of treatments. But of course, we're also, like, I'm a science nerd, right? So I'm not going to just throw this product out into the world and be like, hope it goes well, right? So it's encased in a research study that goes significantly kind of above the cut of what people would normally do if they released a product on the market. We talk about, like, real world evidence type studies where you just kind of, like, let it happen and you sort of passively track what happens. And this is not that. Like, it's a more rigorous study than that. We're really interested in understanding the safety and efficacy of the product, similarly to how people are thinking about, like, certain things just need to be released in the context of this emergency that the world is facing. But we want to do it responsibly in a way where we're monitoring for safety and we're being really conscientious of the fact that we need to also do research to validate it at the same time.
So why is a product like Ensemble, why is this important basically in the context of FDA flexibility related to the pandemic and the rising rates of depression and anxiety that we're starting to see?
Yeah, so I mean, I think that there are a few kind of more low-hanging fruit answers here, like just basic accessibility. So in a world where it's difficult to get physically to a doctor's office, if not impossible, depending on who you are, if you're immunosuppressed or you've got small children. So even now, as things have opened up somewhat, access to medical care is limited. And so if you see these sort of, like, rates of depression and anxiety disorders increasing and access at an all-time low. And let me tell you, access was terrible before the pandemic. There was already an urgent need for this because there aren't enough therapists, right? Therapists do a great job, but there aren't enough of them. There's not enough schedule flexibility. There's not enough ability for people to physically get to therapists or, get on therapist schedules in ways that work with their work. So, like, this was already happening, and then the pandemic made it even worse. So access is a tough nut to crack, and we don't claim to have the solution, but we do claim to have a solution, right? And like, that's not even including the people who might just not want to go to therapy for whatever reason, like might need it in terms of having a disorder that could benefit from it, but it's too intimate. It's maybe too time consuming to schedule an hour. There are all kinds of reasons why people don't seek therapy. And so this is a really important response. Again, mattered before the pandemic, but in the pandemic where, access is even worse, especially important.
Well, I've really enjoyed every response that you give is so thoughtful and is always in depth. Really appreciate everything that you've brought into the podcast today. Hopefully we can have you come back on again, because I've really enjoyed speaking with you.
Would love it.
Awesome. I'm excited. I'm going to throw the social media links to your company in the show notes so people can find it. But best of luck with everything with Happify Health and the newest product offering, Ensemble. And we look forward to having you back on again real soon.
Thank you.